My name is Leah Hemming, and I am the 41-year-old mother of 5, and I had weight loss surgery at Blessing Health System Weight Loss Center. So I mostly gained weight when I was in nurse practitioner school, and after grad school I kind of tried to get back into my routine of meal prep and working out, and I would be successful for a couple weeks and then fall off the wagon, and kind of did that yo-yo diet for several months, and I just decided to ask for help.
Weight loss surgery isn't right for everybody, but it definitely was for Leah, and it's been really beneficial for her health and of course for her weight loss as well. The analogy I use is that the surgery is a tool, and so in order to have the tool work for you, you have to know how to use that tool. And so that's where the team comes into play. So we have a multidisciplinary team of our nurse practitioners and our dietitian and our social worker, and as a team we work together to ensure that the patient is going to have the greatest success with weight loss.
Dr. Mattress was awesome in helping me prepare for the surgery because she explained everything so well. Especially with my initial consultation, I had many questions, mostly not just coming from a patient standpoint, but coming from a healthcare standpoint. I knew risks of surgery, I knew risks of anesthesia, but I wanted to know statistics of how successful it can be, and she really answered all of those questions and then some, and put me at ease.
The last thing we want to do is to ever operate on someone and have it not be successful. And so by meeting the patient and by discussing them in our multidisciplinary teams, we can make sure we really know the patient. We can know their motivation and their goals, and we can assess them to make sure that they are going to be successful so they can have a good outcome.
The care I received at the Blessing Weight Loss Center was phenomenal. Everybody was so friendly and open, and they just treat you like family.
Leah stood out to me in the beginning because she was so motivated when she started the process. She was determined this was what she wanted to do. She already had an excellent exercise ethic, enjoyed working out, which made that transition easier for her, but definitely very motivated and has continued with such.
What stood out with Leah before surgery was she was committed. She knew she wanted this to happen for her, so she worked very well with the team, listened to our recommendations, and was committed to the program. Her smile, she walks in the room, it puts a big smile on your face. You can just tell that this journey has transformed her life, and it's been a privilege to definitely be a part of that.
My personal support system is phenomenal. My husband, Craig, he's been my biggest supporter, as well as my children and my parents, and the staff that works with me, as well as the oncologists that I work with. They've all been very supportive and very interested to see the changes that have happened along the way.
It's not really just about the weight loss. Of course, that's an added benefit, but it's really about the improvements in one's overall health. My goal isn't just to help people lose weight. My goal is to help them to have a better lifestyle and to improve all their medical conditions, to ultimately improve their overall quality of life.
That's the whole purpose of this, is just taking control back of your life.